I sensed things were not right during the pregnancy. All her measurements ended up showing she was growing normally. But at birth, she definitely had dysmorphism. We had more genetic testing at probably 3 different hospitals, skin biopsies, just lots of things. No one could get agreement. You couldn't get more than one geneticist to kind of make a statement, and 2 would never agree. And it puzzled them, and they knew that she had something. Where'd you go to school?
I graduated from high school.
You did? You so did. You did. You eventually just say, okay, we're treating all of her developmental needs, and that's all we can do anyway. This picture is Juliana's graduation picture from Fontainebleau High School. She was so happy. She was 22 at the time. I mean, I think she knew she was pretty special. I never thought in a million years they would ever find a diagnosis. You
That's
do
awesome.
the hokey pokey and you turn yourself around. That's what it's all about. Okay, stand up. Come on.
Come on, Juju. Juliana was diagnosed with Kleefstra syndrome by testing in March of 2021. She was referred to me by her geneticist at that time for evaluation and treatment of behavioral changes, regression, and sleep disturbance.
Give her a hug. Okay. When we got the diagnoses, I had to really learn what Kleefstra syndrome, how to explain it and what it is.
The syndrome itself is complex, and it can present really with a range of symptoms, both physical as well as behavioral.
Okay.
So sweet.
That's a little sensory thing.
Yeah.
She likes to smell people's hair.
Yeah, this is how
She's
she gets to
checking
know
your hair
us.
products.
I want to say 4 years prior to our meeting, Mom described to me Juliana's demeanor and her joy for life, her singing and dancing, loving music, big smiles, and sadly that had really changed in the months and years prior to our meeting. So the information was powerful. It helped us to understand what was causing this, and relying on the research that's been done to help support patients with Kleefstra, we were really able to get some positive results and get her back to living and having a better quality of life.
Good girl. Good. Dr. Chalky has been now, she's kind of like the gatekeeper, I think. She's kind of my lead coordinating physician, which has been such a blessing.
I want spaghetti.
You are hungry, okay.
The MyOchsner app, it has been a vital link to working with Juliana, that as well as even sometimes some virtual visits, and is able, as soon as she learns things from the community she participates in, she sends them to me, and I feel empowered as her provider that she and I can partner in the latest studies or the latest feedback we're getting from families.
Juliana's health requires so much collaboration that it is wonderful that each physician can see my notes to another physician. It's been quite the blessing.
I have a heart award for you.
Okay, give her her.
That
give
means
her her
everything
heart
to
award.
me.
Give it to Dr. Chalky. Here. Give it to Dr. Chalky.
Oh, thank you so much.
There's your
Look
heart
at this.
award.
For your love, for your care, love, and kindness to kids like me. Oh, thank you so much.
All done.
This means
We have seen a big improvement in her personality. It's really more Juliana. But we pedal together and we get exercise, and then I steer. You make Mama work.
I'll do everything in my power that I can, and I'm going to use all the tools that I have available to me to do that. As I think about Juliana's story, it's really just the beauty of love, really. I mean, her mother bringing her here and just sharing so much with me, really helping me understand what their day looks like and how that impacts Juliana and how that impacts her family, and how important, even if we could just make some progress in helping her sleep better at night and helping her to just smile more.